Salaam alaikum. Good evening. My name is Ravi Mantani. I am professor and vice dean at the Institute for Population Health at Weill Cornell Medicine in Qatar. I want to take a moment to welcome you all and thank you for taking the time to be with us this evening on what I think is an exciting topic, and I'll talk a little bit more about that in a minute or two. But you will recall that the Health and Youth Community Wellness Series, which was initiated by Institute for Population Health, has gained momentum. And there's a lot of interest among communities and members of different groups, in fact, in the region around the world. And so we welcome you all and thank you for being with us. The overall goal of this series is to create community awareness about health and related topics. The ultimate objective, of course, of the series is to enhance and support self-care, reduce suffering, improve the quality of life, and increase longevity. A couple of housekeeping notes. Your cameras and microphones are turned off. Please use the Q&A feature to type any questions and comments that you might have. And needless to say that the questions will be addressed at the end of the session. And just a reminder, this is not a CME or CPD activity. This seminar or webinar, in fact, is for public, as I said earlier, and therefore we will not be issuing certificates of attendance for this event. Now to the topic. Let's talk dental health, an exciting topic. And briefly, this session will explore the importance of regular dental visits and the vital role of the dentist in improving dental knowledge for the community, how to prevent dental disease and improve overall oral health. And to discuss that topic with us, we have just a wonderful and outstanding dental surgeon with us, namely Dr. Nizar Kharma, who is a bachelor. If I want to just maybe say a few words about his qualifications and his degrees, he has obtained his Bachelor of Dental Surgery from University of Manchester in the United Kingdom and postgraduate diploma MSc in Oral and Maxillofacial Surgery, also from University of Manchester. And he's also fellow of the Royal College of Surgeons in London, United Kingdom. Dr. Nizar, and in few words, absolutely an outstanding dental surgeon in Doha and in the region, who is not only compassionate, caring, empathetic, but also possesses outstanding skills, surgical skills, in evaluating and managing dental issues and dental problems. And we are so grateful to you, Dr. Nizar, for taking the time out of your busy schedule to be with us this afternoon or this evening. So with that, over to you, Dr. Nizar, and the screen is all yours. Thank you so much.
Thank you, Dr. Mamtani. It's very kind of you, and I feel really humbled by those very kind words. Thank you so much for giving me the opportunity. Can you guys hear me? I just wanted to check that everyone can.
Yes, Dr. Nizar,
Yes,
we can hear you and we can see your screen, full screen, so we're good.
So I'll fire away then. This talk is going to be, I've decided to have the title to be Let's Talk Dental Health. And the reason I've chosen this topic is because I think the preventive dentistry, or the concept of prevention, it's still in its early days. It seems like most members of the public still see dentistry and dentists as, in a way, either treatment or emergency centers. And I think preventive dentistry probably needs more attention and more focus. That's why I've chosen to talk about preventive dentistry and the role of regular dental visits. I'm just going to move on to the next slide. So obviously, Dr. Mamtani has kindly introduced me already, so I'm going to skip this slide. Objectives of this talk are to highlight the importance of regular dental visits, to show the role of the dentist in improving the dental knowledge and the prevention of dental disease, as well as improving overall oral health. But why? Why this topic? Um, I've tried to summarize the reasons why this topic is so important, why preventive dentistry, through the following points: pain prevention, avoiding complex treatments, avoiding lengthy appointments, cost control, maintaining beautiful teeth and a beautiful smile, and a better overall dentist-patient relationship. I'll discuss each one of them individually. So the first point is pain prevention. Basically, the focus on prevention or patients paying more attention to prevention means that they will visit the dentist regularly, and therefore, even if the slightest dental problem is detected, like a little cavity or anything equivalent, then it can be easily addressed during that appointment or in a following appointment, and the solution would be a simple filling. And that would be it, really. It would get rid of any actual or potential problems. If, on the other hand, the cavity is neglected, eventually, because the patient does not want to see the dentist unless there's a problem, eventually the cavity increases in size, gets close to the nerve, and then, of course, we start having problems such as toothache and needing complex treatments such as root canal treatment or crowns and so on. Not to mention extracting bad teeth. So it could even reach the point where we have to remove the tooth. Not to mention the dreaded needle and anesthesia. So that's the first point. The second point why prevention is so important is avoiding complex treatments and keeping it simple. Again, keeping regular dental visits almost guarantees simple, quick treatments, a checkup, a consultation, maybe a scale and polish, maybe a couple of fillings. And of course, if that doesn't happen, then the other extreme would be if we wait till the last minute, then of course we'll end up with more complicated problems that will need more complex treatments. And they might even need to be referred to other colleagues if the treatment is so complicated. Another reason why prevention is so important is avoiding lengthy visits. Again, complex visits, of course, mean longer appointments and probably multiple appointments as well. While if we keep our regular dental visits and focus on prevention, then we are way more likely to have short, quick appointments. And of course, another factor is cost. Again, prevention means, and regular visits mean that we're going to pay, patients are going to pay way less for those short dental visits than paying for complex treatments because of neglect. Not to mention time taken off work. If someone has a busy schedule, if a patient has a busy life and a business that they have to look after, of course, this entails time taken off work and therefore potential lost income. Beautiful teeth. I guess this is self-explanatory. If we neglect our teeth, then dental disease and gum disease will not only affect the health of our teeth and gums, but it will affect their appearance as well. So that's one thing. The other thing is if patients fancy embarking on some cosmetic treatments such as veneers or Hollywood smile or orthodontic treatment, they've got to have healthy teeth and healthy gums. And that's where prevention is very relevant. If prevention is not focused on, then they're not going to have a healthy mouth, and therefore it's going to be very difficult for them to have cosmetic or aesthetic treatment. And finally, why preventive dentistry? Because it will improve the doctor or the dentist-patient relationship. If the patient keeps the regular visits, they will have more confidence in the dentist. They will feel more comfortable in the dental clinic. They'll have a better awareness, and of course, they'll understand prevention in a much better way. So that was why prevention. Now I'm going to discuss regular dental visits. What happens during a regular routine dental visit? I've summarized it as early detection and prevention, preventive advice, and overall health connection. Early detection and prevention. Well, regular dental visits, of course, help identify issues early on, preventing complex treatments. As we said earlier, a small cavity will just need a routine filling or a small filling. Otherwise, a much larger one will end up needing a much more complex treatment. What happens during a dental checkup? So we do a thorough examination and maybe x-rays. Fluoride treatment might be also relevant during a routine checkup, as well as fissure sealants. I'm going to discuss each point of these individually. So the actual examination. So during a routine checkup, we dentists do take a history of the patient. So they take the patient's medical history, the patient's dental history, social history, and so on. So, of course, they have to have a very comprehensive knowledge about the patient's diseases, whether they suffer from any medical conditions, what medication they take, and whether they're allergic to anything. And this is so relevant because, of course, if a patient is allergic to, let's say, penicillin, then and if they ever need antibiotics, then of course the last antibiotic you're going to give is a penicillin antibiotic because that could be dangerous to their health. And if another example of the medical history is if a patient is diabetic, then that's very relevant because then it might entail looking after the patient's oral health in a slightly different way because diabetics, especially uncontrolled diabetics, tend to heal slower, and therefore they might need some special care, especially with the gums and the oral hygiene. After the history, the dental history and the medical history, and the social history, we also tend to examine the face, the extraoral examination, which basically means that we examine the face, the skin color, any asymmetry, the neck, any problems with the neck, whether there's a swollen neck, for example, because all of these can have relevant medical connections. So an example is an enlarged neck could probably imply or could be a sign of a thyroid problem. Now, I'm not a medical doctor, so I don't want to elaborate on that, but we can detect dental abnormalities during an exam that could have a medical implication and could therefore necessitate the referral to a medical specialist. Intraorally, like I said earlier, we check the mouth, the inside of the mouth, the teeth, the tongue, the lips, the soft tissues inside the mouth. And that could be a valuable source of information, not just dental, but even medical. Some examples of that could be, for example, white patches or red patches inside of the mouth could be an indication of some sort of medical problem. Could be as simple as oral thrush, but it could be as complex as tumors and cancers. And all of this falls under the umbrella of prevention. We take x-rays sometimes during an examination, and it's worth mentioning that x-rays are a tool. They're not the only way to diagnose a problem, because I've noticed that patients seem to really put so much weight on x-rays. They do help us diagnose a problem, of course, but they're not the only exclusive way. The history and the examination of the mouth are just as important. Questions, of course, we ask the patient during the routine checkup whether they have any problems, whether they've suffered from any discomfort, and that, of course, could help us find hidden problems that we could then address quickly before they get worse. So questions are very important. During the dental checkup, we could also perform some fluoride treatment. Now, I know it's been a controversial topic for a long time because too much fluoride could cause fluorosis, as most of us know, which is weakness of the enamel. And too much fluoride has even been linked to bone problems. So this sort of treatment is relevant during a routine checkup, but it's not for everyone. It's just worth mentioning. It's not for everyone. You need to choose the patients who can benefit from it. And it tends to be generally patients with high caries risk. So patients with lots of cavities, or patients with a history of lots of fillings or lots of cavities or dental neglect. So not everyone will qualify for fluoride treatment. And it's really important to stress that not everyone will qualify for that. It comes in the form of gel or the form of varnish, depends on the patient's preference. The gel is placed in a tray and it's placed in the mouth for a minute. This is all done in the clinic, of course. The varnish is just placed with a brush around the teeth. Another form of intervention during a routine checkup could be fissure sealants. Now, fissure sealants are a preventive measure to prevent further decay or prevent decay from taking place. So as you can see in this picture, we have fissures that are a little deep, maybe a little stained. These are not carious. They have no decay in them. But in some cases, again, in some cases, not all the time, we probably tend to choose to place the fissure sealants, as you can see, on the fissures in order to prevent those deep fissures from eventually becoming carious and becoming cavitated. Again, this is not for everyone, and we have to choose patients who qualify for fissure sealants. I mean, it could be younger kids with high caries risk, but generally, again, it's not for everyone. It's just worth mentioning that fissure sealants are not for everyone. Personally, I have two boys, a 14-year-old and an 11-year-old, and I would like to think of them as low caries risk because as far as I know, they brush their teeth twice a day, they floss once a day, and they try to stick to a healthy diet as much as possible. So that's why I've not done fissure sealants of them. So yeah, all in all, during a checkup, we try to perform or carry out a personalized, tailored management plan for each individual patient. So there isn't a universal plan for everyone. Each individual patient will dictate their own management plan. Another point, another thing that can be relevant during a routine checkup is preventive advice. So during a checkup, we try to stress or repeat or remind the patients of the relevant preventive advice. This fluoride, toothbrushing, diet advice, and smoking cessation. Fluoride advice comes in the form of course, reminding the patients of the importance of brushing with a fluoride toothpaste twice a day, and twice a day is enough, morning and night. Using a mouthwash that has fluoride in it, or a fluoridated mouthwash, once a day at a different time to brushing. And in some cases, again, in some cases, we could give fluoride supplements. So basically give a prescription of a high concentration fluoride toothpaste or fluoride tablets or fluoride tablets that patients can swallow. Now, I must admit that I rarely do that personally, and many colleagues will agree that this was only done in exceptional cases because if patients abide by prevention, brush twice a day, and keep the consumption of sugar to the minimum, then fluoride supplements will most likely not be needed. Again, toothbrushing as well, we give the patient the relevant toothbrushing advice. We probably sometimes we'll have a model, especially if it's a new patient, to show on the model how to brush the teeth in the most effective way. There are different techniques, and the most effective is called the modified Bass technique, where you hold the brush at a 45 degrees angle on the gum line, and then you brush in a circular motion. I wanted to show a video, but I thought it might take too much of the time of the talk. So it's just very simple, 45 degrees circular motion around the gums and the teeth. And it's important to brush the gums as well as the teeth, not just the teeth, because most bacteria actually live in the gum line. And this will prevent, of course, gum disease. We also advise patients on interdental cleaning, so cleaning in between the teeth twice a day. When I qualified 20 years ago, or even before that, the advice was to use the dental floss, which is the thread, once a day to clean in between the teeth. About 10, 15 years ago, the advice changed slightly into flossing once a day, not once every other day. And about 5 years ago, the latest guidelines in the UK, for example, are that it's best to use the interdental brush, which is what you can see in this picture. It's like a little bottle brush, and it cleans much more effectively than the dental floss, than the thread. And that's to be used once a day. Now, the only incident where we can use the floss is if the gap is extremely tight. Let's say you try the smallest size interdental brush and you feel like it's not going in, or it's really traumatizing the gap, then you can use the dental floss. And overall, the dentist can also give advice on the best toothbrushing option and the best brands, I guess. Generally speaking, I wouldn't necessarily suggest a brand, but I would say for a toothbrush, it's best if it's soft and not too big, so maybe it's on the smallish side, because medium or hard brushes can be quite abrasive to the enamel, and they can wear away the enamel and make the teeth thinner and more sensitive. So that's regarding the toothbrushing. Now, plaque disclosing tablets, I think it's mentioned in this slide. That's another thing that the dentist might mention or might recommend during the visit, or might even use during the visit. And if, for those who don't know what plaque disclosing tablets are, they basically help the patients know exactly which surfaces of the teeth they are missing when they're brushing their teeth. So you basically brush your teeth, you floss in between, you rinse your mouth, and then you chew on a tablet, on a plaque disclosing tablet. And then, as you can see, the pink stains showing indicate the areas where you're missing appropriate brushing or proper brushing. So then you go back and brush those surfaces. And then the next time you use the plaque disclosing tablets, hopefully all of those areas will be nice and clean. So it's just a way to help you improve on brushing. Also, diet advice is another important topic, or another important point mentioned during the dental visit. Basically, the dentist will advise the patients on the best foods to have. Of course, we generally advise patients on focusing on healthy, sugar-free diets or extremely low sugar diets, staying away from sugary diet as much as possible. So staying away from the usual suspects, you know, chocolate, cookies, juices. And by the way, even fresh juices, we consider them as sugar. So even if you make some fresh orange juice at home, unfortunately, we see that as sugar. And that's why it's either got to be avoided, or sugary stuff can be consumed, let's say, straight after lunch, or maybe with lunch. So a typical scenario would be maybe having, I don't know, chicken, salad, rice for lunch. And along with that, you can have a glass of orange juice. And then just after lunch, you can have some chocolate. And the philosophy behind that is, when you consume sugar just after a main meal that's not sugary, the proteins and vitamins and carbs in the non-sugary meal will balance the effect of sugar. And that's why you're way less likely to develop caries. Also, dentists will advise patients on what sugars to avoid. So our biggest enemies are gummy bears and fudge and caramel and jelly beans and anything that's sticky. Basically, sticky sugars tend to be really much worse than normal sugars because they will stay on hidden, let's say, along the surfaces of the teeth, and they're going to be very difficult to remove, even if you brush well, and then they just end up attracting bacteria and causing more decay. So in my opinion, they should be banned. Now, diet sheets sometimes can be discussed between the dentist and the patient. I personally sometimes will ask some of my patients to fill out a 3-day or a 4-day diet sheet. So I'll see them on, let's say, a Saturday, and then I'll see them again on a Wednesday, and they will have filled out a 3-4 day diet sheet to show exactly what food they've consumed over the previous 3-4 days. And that will sometimes help me pinpoint or try to highlight where they're going wrong with their diet, whether they're consuming too much sugar, or maybe they're consuming sugar frequently, so more than once a day. So that will help the dentist establish the best advice they can give patients regarding diet. Also, smoking cessation is very relevant during a routine checkup. This goes back to social history. So if during the social history questioning the patient confessed that they're a smoker, then we can definitely give them some advice, some information on why smoking is so bad for the oral cavity and for the mouth, but also for overall health as well, as we all know by now. And it could be also relevant to refer them to maybe smoking cessation centers or the equivalent to help them quit smoking or cut down the number of cigarettes per day. And also nicotine patches could be relevant as well. So they could either be prescribed that by dentists, or maybe the dentist could refer them to healthcare professionals who could prescribe the nicotine patches. Also, during a routine checkup, dentists can also highlight the link or make the patient be aware of the link between oral hygiene and heart disease. And to maybe many people's surprise, poor oral hygiene or really bad active gum disease can potentially cause cardiovascular disease, because potentially a piece of calculus or plaque or bacteria can escape the gums and get into the bloodstream and then form clots or plaques. Now, again, I'm not a medical professional, so I guess medical professionals will probably elaborate on that, but there's some firm medical evidence to show that link between neglected and poorly prevented oral cavities and cardiovascular disease. Also, a patient's medical history can be relevant. Like we said earlier, a diabetic patient will probably make it important for the dentist to highlight the importance of oral hygiene. They probably will need a more aggressive oral hygiene treatment or oral hygiene advice, because their gums will be more likely to get gum disease. Patients who've had chemotherapy, for example, they'll suffer from dry mouth, and that's why fluoride treatment might be relevant than the one that I mentioned before. So they'll get a tailored management or an individual personalized management for each individual patient. Now, we're going to discuss briefly the role of the dentist in improving dental knowledge. So this is done through educational initiatives, personalized guidance, and question and answer sessions. I'll discuss educational initiatives. So dentists can leave their practice and go out and preach their messages through either workshops, seminars, awareness campaigns, and also practice open days can be quite relevant. I'm not sure how often this is done. This is done in this country. I've been in Qatar for 10 years, but it's not something that we normally do here. But back in the UK, I do remember that on a Saturday morning, for example, or a Saturday afternoon, we would have a practice open day. where we would invite patients to come along and maybe discuss dentistry in general, but also discuss prevention, discuss the importance of regular visits. I did notice that those practice open days would attract more patients to come and visit regularly, and therefore they would really help the message of prevention get through to the public. So that's one very important thing as well. Also, school visits are really beneficial. I remember doing a few in the past, and I find them quite useful for the students, the pupils, and the teachers as well. So I think that can be a very useful tool. University visits and the media can be a very useful educational initiative, whether through traditional media channels, TV, radio, and so on, or through the more what's the word 21st century platforms such as Facebook or other social media platforms. Now, of course, I have my only issue with the social media platforms is that I've noticed they're not exactly very well regulated, but then I'm sure with time things will improve and there will become such a regulation where not just any person will go and preach on prevention or other medical topics. So I guess it needs more regulation. Now, the other point is personalized guidance. So another way to improve dental knowledge is in the actual dental clinic, in the chair. So once the patient has finished the visit, let's say the routine visit or even the treatment visit, you sit them up and you give them some advice. You remind them of all the preventive advice, and you say it in the most friendly manner because you're not there to preach them or to scold them or tell them off. You only, it's 2023. Patients won't accept that anyway. They won't come back if that happens. Positive reinforcement is important because encouraging them, praising them for the hard work will make them appreciate prevention, will increase their knowledge, will make them want to know more about prevention, more about the importance of dental knowledge and dental awareness. And repetition. Repetition is very important because they're not dentists at the end of the day. We are the dentists, and that's why the more you repeat the information, the more they're going to be retained. And finally, question and answer sessions. You can always ask the patients after a visit whether they had any questions that are relevant, any questions that they would like you to answer, any concerns. You need to allow them enough time, of course, and try to answer the questions in the simplest possible way. Simplicity means they're going to retain the information, understand them. That's why it will improve their dental knowledge and their appreciation of the message of prevention. And try to summarize the main points as much as you can to keep it simple. Just very quickly, because I know we're kind of approaching the end of this. We've discussed prevention, we've discussed the importance of prevention, what happens during a dental visit, and this is all great. But I think it's worth mentioning or worth admitting that there are still challenges to prevention and obstacles to try to get the message of prevention through to the general population. Because let's face it, I guess there's still quite a big chunk of the population that are still not aware of the message of prevention and the importance of regular dental visits. So trust can be an issue, cost, time, and poor awareness. Trust, of course, as you know, lots of patients have had horror stories about things going wrong with a dental chair or some bad experiences shared by a colleague or a friend or a next door neighbor or the equivalent. Also, the concept of different treatment plans. Different dentists will give different treatment plans. So the patient is a bit nervous and they've decided to get more than one opinion. They sometimes will get a bit confused by the fact that different dentists are giving different treatment plans. Well, I can assure you that's purely normal. And if anything, I think that's a healthy phenomenon. And it shows that there can be some flexibility with treatment plans. Different dentists come from different backgrounds and different academic and professional backgrounds, and this explains the different plans. Overtreatment can be another factor that really affects the patient's trust towards the dentist. Because of the overtreat, because money, I guess, would be one reason behind overtreatment, or maybe just the way the dentist is trained. They're just trained to overtreat. That could affect trust. Undertreatment can be another problem. Dentists could undertreat if maybe, I don't know, maybe they're salaried and they're on a fixed income, and that's why, further treatment is maybe irrelevant because it's not going to affect the dentist income. And it's worth mentioning that most dentists are very conscientious and they don't think that way. I'm a dentist and I can assure you the majority are not like that, but that could exist. For example, on the NHS in the UK, there's this maybe quite unusual system where the dentist will get paid a certain amount of money for a crown, let's say, but then they'll get the same amount of money for 4 crowns or 3 crowns. So sometimes, a minority of dentists will probably think, well, I'm just gonna do 1 crown then. If I'm only getting paid for a certain amount of money, I'm not going to pay more for more crowns. I'm just going to do 1 crown. That's a big problem. Pain is another factor that could affect the trust. Costs, dental fees, that can be extortionately expensive sometimes. The lack of flexible plans, the lack of dental insurance, cheaper treatment abroad. As you know, a patient could come through the door and say, look, I'm not gonna come and see you again. I could easily go to, I'm not gonna mention countries, but I mean, Turkey is a big thing now. Go and pay a third of the cost and get my mouth done. And why should I care about prevention? I'll get everything done quick. I think those issues will affect the message of prevention. Time can be an issue as well. Time can be a big issue because if the dentist has a very busy schedule, then it could affect access, could affect the patient's ability to book an appointment. If the patient is busy and the surgery doesn't have flexible working hours, and that could be an issue. Not to mention long waiting lists. Poor awareness, like we said before, that could be another hindrance as well, another obstacle to prevention. Culture in society could be that patients from certain backgrounds grew up to the idea of seeing the dentist as an emergency healthcare professional and nothing else. So that needs to be changed. Poor access to the media could be another reason as well. So how to overcome those challenges? Quality training. Dentists should be better trained as to becoming more empathetic, more sympathetic. I'll just go on to the next slide. Better communication, better teaching of dental ethics. Quality assurance, dentists and healthcare professionals have to go on continued CPD courses and continued professional development to keep the quality, quality care and to maintain their skills and maintain their communication skills. Of course, better communication is very important. We have to respect patients from different backgrounds. We have to be patient with our patients. And we have to be sympathetic and empathetic for sure. And I'm sure you know the difference between sympathy and empathy. Sympathy is to sympathize with a patient, and empathy is to put yourself in their place, which is, in my opinion, the epitome of sympathy. Better pay, as we discussed before, higher salaries for dentists could probably help them focus on giving or delivering better quality treatments and better quality prevention and preventive advice. Incentives to better focus on prevention. And of course, cost control. This is relevant for the patients. So, maybe to find a way not to, give some dentists, not all of them, to abuse prices and make them extortionately expensive. So maybe for the Ministry of Health to be able to oversee those lists. And I think that happens in Qatar, by the way. They control the prices, and there's an upper limit to whichever costs you can charge the patients. Decreased cost gap between prevention and restoration. So one of the reasons maybe some dentists, not all of them, will try to focus more on doing things than prevention is maybe the big price gap between them. So I guess if dentists are paid better for preventive advice and preventive treatments, then I think that would help as well. And of course, to control extensive treatment plans. Flexible working hours, that will also help overcome the limited access to prevention. So patients will be able to see the dentist more often, more regularly, because of the ability to take time off work. So I think rules and regulations at work have to be more flexible, allowing patients to take time off work or even take sick leaves if needed to see the dentist, and more accommodating dental working hours for sure. So practices or clinics have to be a bit more flexible with their times, with their opening times. Staff, of course, employing more staff and better quality staff, more efficient staff will also help increase access and improve access. And that's why I think it will help the preventive advice getting through to as many people as possible. Patient awareness and knowledge, I think better patient education could start from as early as nursery or school days. So when you educate kids as young as 3 or 4 or 5 about the importance of prevention, whether dental or medical prevention, I think that will create a society that's more aware of that importance of prevention. And that's why it will help the message of prevention to get through. To conclude, there are challenges to prevention that need to be overcome for better overall dental awareness. More work is needed to improve public awareness, for sure. Prevention is better than treatment, as we all know. Regular dental visits are important, they're vital, and they lead to better overall dental and medical well-being. And of course, more money in our pockets. I think this concludes my presentation, and that's it really. Any questions at all? I'm just gonna move on to the last slide. This is my email address, just in case you would like to ask any questions about prevention or preventive advice, or anything that we discussed during this presentation. Thank you so much. Thank you. I hope I wasn't, I think 45 minutes we've managed.
Thank you. Thank you.
Thank you.
Dr. Nizar, you were just amazing. You were simply amazing. You touched upon, your talk was so comprehensive, so relevant to people in general in communities around the world. So thank you so much.
Thank you.
Do have a few questions. So let's roll up our sleeves. Obviously, the public out there who are at the receiver's end, if you will, have concerns, have questions. So I want to begin with a couple. There's a question on fillings. Oftentimes, fillings were done 10, 15, 20 years ago. They often come out. People don't even know whether they've come out or not. And a related question is, should people be concerned about those fillings in terms of the metal used in those fillings, mercury, and so on and so forth? So can you please respond to those issues? They have to do with fillings. How do people know that the filling has come out? Some do, some don't. So I'm wondering if you can comment on that, please. Thank you.
Thank you, doctor. Now, I'm going to start from the very last point you mentioned, silver fillings and metal fillings. Now, those ones are less relevant these days than they were maybe 10, 15, or 20, 25 years ago when I was a student, because lots of countries have actually banned silver fillings, mercury ones. personally, I don't think there's any scientific evidence still yet, any firm evidence to say that they are necessarily bad for your health, but they have been banned. And one of the latest countries, actually Qatar, has banned them recently. I think it was 2019 or 2020. We received a memorandum to say that they are not allowed anymore in this country. I think they're still legal in the UK and many other countries. Now, regarding lost fillings, how do we know that fillings have come out? From my humble experience, I think it's usually easy for patients to tell. They'll either be able to tell uh, by the fact that things will taste differently. They'll have an unusual taste in their mouth, an unpleasant taste, sometimes an unpleasant smell. They could sometimes feel it when they floss. They'll feel like the floss is not getting through as easily, or maybe it's getting through way easier than before. It could be that they will notice some discoloration or some chipping. So there's more than one way they will know. But I think my advice with regards to that is two things. The first one is for them to keep their dental visits every 6 months. Now it could be every 3 months, depending on the patient. But A, to keep their dental visits, and B, maybe just to if they're in doubt, to call the dentist up and to ask for an emergency appointment and check. But yeah, like I said, there are other ways, but it's not always easy for them to know.
Thank you. Thank you so
You're
much.
welcome.
The other question has to do with, I guess, how often should people see their dentist? And I guess I'm interpreting that to mean how often should one go for cleaning,
The frequency, yeah.
screening, and so on and so forth. Can you just embellish on that, please?
Sure. So I mean, this is an amazing question because there's no 100% general rule for everyone that applies to everyone. As I said during the lecture, even fluoridation is not for everyone. There's fissure sealants are not for everyone, and the same applies to the frequency of a checkup, of a regular checkup. It depends on the patient. That's my answer. It just depends on each individual patient. If it's someone like me or like the average person who has controlled gum disease or minimal gum disease, they haven't got any major issues. Once every 6 months is enough. It's important though. It needs to be done once every 6 months, but it's enough. If it's someone with really bad gum disease, really bad gums, bad teeth, then it's probably once every 3 months. Especially that they will need regular cleaning every 3 months as well. And if it's, let's say, someone with a full denture, so no teeth at all, an upper full denture, a lower full denture, sometimes it could be as little as once every couple of years. So it depends on the patient. But let's say, as a general rule of thumb, I would say once every 6 months for most people.
Okay, thank you.
You're welcome.
The next question has to do with the culture. I think you brought up culture a couple of times in your discussion, and I'll read the question to you. There are many cultural practices that influence dental health, and I think we agree on that. How do we negotiate with such delicate aspects? I mean, I don't know. I mean, it may have to do with the diet. I know people in the Indian subcontinent who eat betel nut, for example,
Yes.
and so on and so forth. How do you negotiate with all those things?
Yes, well, I like the word negotiate because that's the only way you can get through this. Otherwise, if you use the very old-fashioned paternalistic way of I know it all, just listen to me and stop. Or I think a more common one in this country is probably smoking. And again, you have to be flexible. Of course, you have to tell them that look, this is really bad for your teeth. It's even worse, really bad for your soft tissues. Whether the I think it's called the pan chewing or whether smoking, they're extremely bad. I can't tell you how bad they are for the gums and the soft tissue, and they dramatically increase the chance for gum disease and even oral cancer. And unfortunately, I've seen it a few times already. And I've only been a dentist for 20 years now, and I've seen it 3 times already. Those things are responsible for killing killing people, sorry. But I think the problem is you can give the information, uh, you can educate the patients and tell them your stories and tell them your knowledge, but you just can't force them. How do you negotiate? It's very difficult. It's very difficult. I think I would say you give as much information as possible and you repeat the information. And every time you see them, you repeat the information. And anything that happens to them that's related to smoking, you can say it in a friendly way to say, look, this is happening now. I've taken your tooth out. It was an easy extraction, but your gum is not healing even after 7 days because you're a smoker. So I think maybe try to inform them in a friendly manner, repeat the advice, and try to make it as relevant to them as possible. And I think eventually they'll get the message, but it's not easy. It's not easy to change people's habits, I guess.
Thank you. Thank you.
You're welcome.
The other question that comes up every now and then, and my breath does not feel fresh. Maybe there's a little smell to it, if you will, or I know people, that's why I don't eat garlic in the morning and go out, for example. But what can people do who feel that their breath is not so fresh, or there's a smell to it, if you will? Are there self-care things that they can do, or what can they do?
I mean, it sounds cliche and boring, especially after this lecture, but I would definitely say go to your nearest dentist or go to your regular dentist and ask and mention the problem, and then they'll be able to help. I think the number one reason is usually from the oral cavity. If it's bad breath, then it's the oral cavity. It's a dental issue. So like we mentioned earlier, fillings, it could be a lost filling, it could be a decayed filling that has decay underneath, could be caries, could be decay, like fresh decay. Could be gum disease, because that can be very smelly. It could be that maybe some people have to brush their tongue, for example. Brushing the tongue is not for everyone, but it could be helpful. So in other words, I would suggest that they come and visit the dentist just to make sure that they haven't got any dental problems. If they do, then the dentist will both address it with preventive advice and with treatment, if needed, if there's any treatment needed. And finally, if all the dental factors are exhausted and there aren't any issues, then our next step would be to refer to an ENT specialist. So first the dentist, if there's nothing there, then it's the ENT specialist.
And I think you make a good point. I remember, in fact, it came up in one of our seminars, chronic sinusitis being an important reason why people may have some smell, and therefore visiting an ENT specialist would be appropriate. But thank you for that. So we are not done yet. You've generated a lot of interest. So if I may go ahead for another couple of minutes, if you don't mind, another couple of questions.
Please.
Bleeding while flossing. I know that in some people it happens and it's normal, but when should we be concerned about bleeding while flossing? Any indicators, any guidance on that?
Right. I think my answer is probably going to surprise quite a few people, but I think ideally, when we brush our teeth or when we floss our teeth, they shouldn't bleed. So, and I know in most of our cases, they will bleed, but this is a sign of gum disease. Now, gum disease is not such a scary thing. It can be easily rectified with, a dental visit, oral hygiene advice, and so on. But what I'm trying to say is ideally, our gums shouldn't bleed when we floss. They shouldn't bleed when we brush. So this is definitely a sign of gingivitis, which is inflammation of the gums. And this indicates that we have to see that. I know I keep going back to the same point, but seeing the dentist is very important, because then the dentist will probably diagnose the gingivitis, address it with probably a simple scale and polish and some oral hygiene advice. Now, for those who say, well, but we've just been to the dentist and had a scale and polish, then it could be simply that maybe they're not brushing the teeth and flossing them as well as they should, or it could be trauma. Maybe it's trauma. Maybe they shouldn't be using the floss so aggressively, and they should be using it gently. It could be that they're just traumatizing the gums because of being so aggressive with the floss.
Thank you.
You're welcome.
If I may just follow up with one more question.
Please.
And I think your answers are fantastic. They put things in perspective. And certainly, based on the comments, the community is benefiting. So thank you. This question has to do, you talked about fluoride. And I know I have an interest in public health that obviously cities around the world will ensure that there's enough fluoride content in the water.
Yes.
Is that sufficient for people to prevent gum diseases or caries or so on and so forth? And then I know you mentioned fluoride supplements. You were cautious in your remarks. But generally speaking, it's my impression that the fluoride content in the water is adequate enough. Should some people be taking fluoride supplements as a rule, or?
Now, of course, doctor, you're the expert. Correct me if I'm wrong, but I'm not. I've tried to do some research on water fluoridation in Qatar, and the impression I got is that it's almost not fluoridated, like water supply anyway.
Okay.
But I might be wrong. But I think in answer to your question, I would say that generally speaking, for most of us, maybe not all of us, if we brush twice a day with a fluoride toothpaste and we use a mouthwash once a day, then that should be enough. It should be enough. So because too much fluoride can cause fluorosis, like I said, which can be quite detrimental to the health of the teeth and to enamel.
Lot of thank you pouring in, excellent webinar and so on and so forth. So we thank you, but there's one final question that just came up.
Please.
And it mentions tooth sensitivity. And why do only some people have it and others don't? Is this more of a personal issue, personal perception? Can you?
I think, sure, of course. I think it's, yes, I agree that not everyone has it, and most people probably don't have sensitivity. But I think what happens is sensitivity is mainly due to the wearing of the enamel. So enamel is a bit worn. And the number one reason behind that is aggressive or excessive brushing. That's why I always advise my patients to use a soft toothbrush, not a medium one, not even a medium one, just a soft one, and to replace it every 3 months to guarantee that the bristles are as soft as possible. And this will decrease the likelihood of wearing the enamel, because when the enamel is gone, or when it's worn, or when it's thin, teeth become exposed or naked and they become more sensitive. So that's one reason. Another reason could be that some teeth are just naturally more sensitive. I agree. Some people have this genetic predisposition to having more sensitive teeth than others. But I think it's mainly us who do that, who cause that, and that's the aggressive brushing. So I'll just take this opportunity and say before we conclude, please do not brush aggressively. Brush gently. You need to brush the gums and the teeth. You have to. You must do it, but you mustn't brush excessively or aggressively, because this doesn't make your teeth whiter. If anything, it makes them thinner, more sensitive, and even darker, by the way.
So I just want to say thank you so much. Cornell is grateful to you for your wonderful talk.